I'm Dr. George Anterasian. This morning we're going to be performing the Thermage procedure on Carmen. The Thermage procedure is a good procedure for tightening the tissues of the face when the tissues are only mildly or moderately lax. The Thermage procedure works by delivering radiofrequency energy to the skin. Within the tissues, the radiofrequency energy is converted to heat, and the heating action does two things. First, it tightens existing collagen, and second, stimulates production of new collagen. The new collagen comes out over the next 4 to 5 months. So with the Thermage procedure, there is first an immediate effect, and then the Thermage procedure matures and improves over the next 4 or 5 months as the new collagen is laid down. With Carmen, she's a relatively young woman, and she has mild laxity of the tissues of her cheeks. We're going to be using the Thermage procedure this morning to try to tighten up some of this laxity. We're going to begin by putting a treatment grid on the skin. This acts as a temporary tattoo and helps us to keep the treatment very organized and very uniform. We apply a coupling fluid to the skin. This enhances the penetration of the Thermage energy into the skin. Okay. The first thing we do is a calibration. That completes the calibration. So this is our first Thermage pulse. Carmen, what are you feeling?
A little warm.
Just a little warm?
Mm-hmm.
Okay. The treatment tip: immediately prior to the delivery of the radiofrequency energy, also sprays a coolant onto the skin's surface, and that coolant acts to keep the top layer of the skin cool while the radiofrequency energy heats the deep layer of the skin. So there's cooling of the top surface, which is protective, and the heating goes deep into the skin. It's the heating deep in the skin that produces the beneficial effect of the collagen tightening and the production of new collagen. Are you comfortable?
Mm-hmm.
Great. That completes one pass. The key to Thermage is to make multiple passes over the tissues at energy settings that are easily tolerated. It's the multiple passes that gives a good result, not treating at high energy levels. You comfortable, Carmen?
Yes, I am.
Again, as we go around the jawline through here, we're going to lower the setting a bit because this area is a little more sensitive. So I've turned it down just a little bit. Lower your chin all the way down. So we'll finish our passes on this side and then go to the other side. We have finished 5 passes of Thermage over the skin of the left cheek, and so we are finished on the left side. I'm now going to go to the right side and do the identical procedure on the right.
That was good, Dr. George. It wasn't painful at all. I was really nervous.
How do you feel?
Good. I'm ready and excited for you to do the other side.
Okay. Okay, so we're going to put the treatment grid now on Carmen's right cheek. Again, this just acts as a temporary tattoo to help us keep the treatment very organized and very even, so it's a nice uniform treatment over the skin. Okay. The coupling fluid, as I've mentioned, is used to enhance the penetration of the Thermage into the skin. How are you feeling, Carmen?
I'm feeling good.
You comfortable?
Mm-hmm.
Okay. You can raise it one level again. When the procedure first came out, it was a one-pass technique at very uncomfortable and painful energy levels. The development of the new tips allowed the procedure to change to one in which multiple passes were delivered, many more pulses were delivered, but at energy levels that patients could tolerate much better. What we learned from Thermage was that it was the multiple passes that actually gave rise to the improved results, and it was the development of these newer tips that made the multiple pass technique possible. So we're going to finish up the final pass on Carmen's cheek and upper neck, and then we'll get her all cleaned up and see how she is. How do you feel, Carmen?
I feel great.
Feel good? Okay, let's get you cleaned up.
I'm amazed
Okay.
I got through it.